This podcast is brought to you by NHS England. NHS Citizen is a national initiative by NHS England to give the public a voice on healthcare matters and influence NHS decision making.
Hi everyone and welcome to this podcast. My name is Nia Bennett and today we're in the NHS England office and I'm speaking to a very special guest, David Scott. David is a member of the NHS England Older People's Sounding Board. The Sounding Board comprises of a diverse group of older people who meet through the year with policy leads and commissioners to shape and improve NHS England's programmes of work. It aims to reflect experiences of more seldom heard older people, including older carers, those with minority groups, and those with complex health needs. So, in today's conversation, David is going to talk us through his journey, tell us about his role in the Sounding Board, the evolution of the NHS, and the barriers to healthcare access among older people. Hi David, thanks for coming. Could you tell us a little bit about yourself?
I've travelled over from Crewe, quite an excitement, by rail, and the biggest thing, of course, is being able to get a seat on the train these days, but that's okay. So yes, from Crewe, which is my base, although I have a split life, I double between Crewe and Northallerton, because following the death of my wife in 2012, I met another lady who lives in Northallerton. I've been retired from my full-time work, which was training teachers, largely, during the 80s and 90s. And subsequent to that, I have filled up my retirement to meet some of the things which I would have preferred to have done earlier in my life, because I am basically a frustrated doctor. I could not do A-level physics in the days when A-level physics was a requirement for medical school, and so I ended up doing a degree in geology. And that has served me very well for my career, and as an extra bit of pleasure when I go out walking, or my friends and I go out walking, and they provide me with bits of stone and say, "What's that?"
Well, I'm glad that you're here and I'm glad that you are so passionate about the NHS and you're here to talk about the work that you do. So do you want to tell us a little bit about the NHS Sounding Board and its work?
Yes, the NHS Sounding Board came a little bit out of the blue, because a lot of the other work that I do around the medical profession hasn't strictly anything to do with the NHS. For example, I'm involved with the National Institute for Health Research and the Alzheimer's Society. So the NHS Sounding Board came a little bit out of the blue. It was a competitive situation, which I picked up from the internet. And I think I was told there were 70 applicants, and there are about 15 members of the Sounding Board who are widely spread from around the country. People from Newcastle upon Tyne, from Liverpool, and I'm from Cheshire, of course. People from the southwest, people from the Midlands, and the London area, of course. And so there's a wide representation of both geography, and that's interesting, of course, because service delivery in the NHS can be very different from one area to another, and also a wide variety of experience. I have no direct medical experience other than that. For example, I cared within the family for about 30 years for, first of all, my mother-in-law and then my wife. So I have that as a substantial piece of experience. But essentially I don't have any medical qualifications. I am a scientist, and that obviously helps in seeing some of the stuff that is brought forward. And so the Sounding Board, the idea of the Sounding Board is for the NHS to deliver to an audience, if you like, for testing. And so people who are developing ideas and new processes, new systems, come to the Sounding Board, having presented a paper to them, and then we will discuss it in groups. We can ask questions, and as far as I know from the feedback that we've had back, they find this very helpful.
So when did you join the Sounding Board, and what's inspired you? Is it your love for medicine and the fact that you said that you wanted to be a doctor?
It's a bit of both, really, because, I mean, it's one of the advantages that volunteers get out of these things is that you meet doctors and you're talking about up-to-date stuff in the area, in research and in practice. But also it's about the delivery, because that's really what has driven me. I think where I started in this process in the early stages of my now 20 years of retirement was to become the chairman of my patient panel, the GP patient panel, which was very interesting because you are encouraging people to have a reflective attitude to what's going on in the practice. Some people to join so that they will engage more seriously. It's quite difficult to get membership because for many people, when they go to the GP surgery, all they want to do is have their appointment and go home, isn't it?
True, yeah. I don't think a lot of people even know that you can be involved with your local GP.
Well, I think that was one of the things I helped to develop in my own practice. When I go there now, I'm not a member anymore. I was there did that for about 3 years. The walls are plastered with all this stuff, and they do surveys. There's always survey material on the desk, reception desk and so on. And I know because my practice was in a consortium with a group of practices in South Cheshire, I know from other practices who would come to the consortium meetings that a patient panel's activities can become very intensive and very valuable to the practice. For example, there is one not very far from Crewe where they are running dementia support groups and things like that, which is absolutely brilliant.
That does sound like really lovely work. So, do you have people from different age groups in that panel?
There were people of different age groups, but not young people. Young people are the very most difficult, I think, to engage. I mean, the Sounding Board, because it is focusing on aged or medicine for aged people, essentially they are of an age and onwards. 65 plus, I think, is the guideline. But there are people. Well, I'm 79, and I know there are people there who are over 80 who come to the meetings, and they're well supported. But they have this passion. That's right. Yeah. Because we all got caught up. Probably, I think, when I was with the patient panel. They were starting to develop these ideas about the patient at the centre. There's a stock phrase which was doing the rounds. Yeah. With that in our heads, we try in every way to try and engage the patients. That's the first thing in research, a word which some people would find difficulty in interpreting, wouldn't they? But also to improve the quality of the interactions between the patients themselves and those who are delivering the services, the clinicians, the GPs, the practice nurses in the practice and all those things. And my honest opinion is that over that period of time, which is knocking on for 20 years now, things have improved considerably. Yeah.
So, off late, what sort of discussions have you been part of at the Sounding Board this year or the past year?
So, empowering people through digital services, frailty, which is particularly high on the agenda at the moment, end-of-life provision, mental health services, dementia care planning, transport to appointments, whether it be the hospital or the GP surgery or whatever. We've been introduced, and I didn't know about them, but we've been introduced to sustainability and transformation plans, which are driving everything that's going at the moment, I believe. And care planning. So the full range almost there, isn't there?
That's quite a wide variety of topics right there. So what is your role as a Sounding Board member when it comes to decision making?
There is no decision responsibility in the board. It is, as it says, it is a sounding board, which means it's reflecting on policies. Obviously, because we get the information in advance, we have a chance to ponder on the proposals that are being made by NHS specialists, and we get the people who are actually planning the policy. So that, I think, would be the meat of it.
And how often do you meet?
There are about 3 meetings a year, and they're all in London.
So how would you say, because you've seen the NHS and you've been a service user, how would you say has the NHS evolved over the years?
It's had to drive itself in relation to increased demands. Medical technologies and medical research has produced new ways of treating people. So to take all those on board, as I said earlier, I think that the idea of sensitivity to the patient has improved enormously. I think that the real problem, in my view now, is the serious shortage of staffing.
So keeping what you've said in mind, you've spoken about how much the NHS has evolved. Keeping that context in mind, what would you say are the barriers to health and care for older people?
Well, we mentioned staffing, financial resources in order to buy equipment. I mean, I have an opinion about the amount of scanning equipment, for example, which is in the National Health Service. If I compare it with other countries that I hear about, even in America, which doesn't get many good comments about its health service, the amount of scanning equipment for quick and rapid diagnosis, it just seems to be lacking in our country. It seems to be an area where investment has not been done. Such that in many areas the scanners are only purchased where they can raise enough money locally to buy it. We had a very lucky shot in our area because a local businessman, millionaire, when we were starting off a fund to buy the one that's just been fitted, he turned up with £1 million to buy it. Well, that doesn't happen. It doesn't happen very often, does it? But it's a point worth making that and there seem to be more of these millionaires around these days. If people could have that sort of attitude, of giving stuff back. But I commend very much the people who do fundraising because they work jolly hard at raising the money.
Yeah, it's tough piece of work as well, fundraising and convincing people to give the money, but absolutely agree with you about giving back to the NHS just as much as it gives you. So something else which is always in the news and written about is about older people and feeling vulnerable to social isolation. That could be because of many reasons, because of death or loss of income. So keeping that in mind, what can the NHS do and what sort of work can be done to improve this?
I think the social isolation is a big issue now. I actually went to a conference which launched off a thing called the Campaign Against Loneliness. And the thing that is encouraging me over the last few years, I mean, I recognise the isolation thing because I have relatives who will be in that position. I mean, I'm at home when I'm in crew on my own. Had to get used to living on my own. But even in these communities, I mean, the community I live in the extra care home, is a community of 150 people because there are 130 apartments and some of those have 2 beds in, so there are 2 people in the apartments. But if we have events going on, you'd be lucky if you got more than 60 people turning up for events. And you can break that down in more detail, but it gives a picture, doesn't it? And I've heard people say within the care home when I have to sit down and chat with people, that they feel lonely even though they are amongst all those other people. They have carers, but I've sensed over the last few years a great effort now to do something about this. So that, for example, the Daily Mail is running a big campaign at the moment about people offering to volunteer to help in the NHS. Now that's not necessarily in the social care system, which of course is run by local authorities, isn't it, and private organisations. But they've already turned up about 100,000 volunteers who are offering maybe something very small, to help feed somebody in a ward, or carry drugs. One particular story I read was about how much time had been saved by people just taking drugs to those people who are waiting for discharge. Because often people are sitting around, in a ward waiting for somebody to bring their drugs, because the pharmacy is overloaded, inevitable. So if it's dependent upon the nurses from the ward going, they haven't got the time, have they? And so I sense that. But what I sense even more is things like the Alzheimer's Society has set up like a 24-hour telephone line. That's perhaps more particularly for people with dementia. But there's all sorts of groups which are setting up now to try and give people support. The NHS will do what it can because it recognises the potential outcomes if people live in isolation for long periods. And I know, for example, an interesting one at which I came across, which was of like a local hairdresser, set up a meeting and just got some cake, cups of tea, invite people, come for an hour. And those sorts of little things in large numbers are happening. I mean, I'm a church member. Church has a big role to play because not only is it cups of tea and a piece of cake, but sometimes it's a meal. Sometimes it's, an afternoon of activities which keep people engaged. I'm quite hopeful in that respect because I think the bullet has been bitten, to use an odd phrase, but it is a recognition of the importance of people not being isolated.
And I think the NHS is actively doing a lot in terms of campaigns, like to check on your neighbours, especially during winter time. Just make sure they're okay. Just ask them for a cup of tea. Just small gestures, really, to show that you care. The
charities who do things, like cancer research, the Alzheimer's, and all the other various charities for the other different conditions, all have groups. But there's a nice one in Cheshire, I don't know whether it's repeated anywhere else, and it's been running for a little while now, is to make use of the fire and rescue service. And the fire and rescue service, which will do this all over the country, I think, offers fire safety checks. We'll be offering that to everybody. In Cheshire, they have deliberately now designed a process whereby the fire and rescue personnel who go will be checking up on safety issues. That's health and safety, but it also would allow somebody with quite a little bit of normal nous would be able to report back to Mrs. X seems to be running a temperature, or she's got wounds which need attending. That's an extreme example. But yes, that is a very deliberate policy right across the old county of Cheshire. So, I mean, some of the things we've already talked about, but you must know this, and NHS England is already working with partners across health and social care, to reframe frailty, promote tailored and personalised care planning. It's got self-management through the Healthy Ageing and Healthy Caring guides. So what else can be done to support older people? I mean, the literature is overburdening, really, these days. I got these out just to look at. Tips for better communication with a person living with dementia is that one. Multiple conditions in later life, priority setting partnership. I think that's largely based at Newcastle University. It'll be based on a piece of research of some sort, and that's an output from it. Here's another one, 6 Principles for Engaging People and Communities, published by the People and Communities Board. That was in June 2016. And you can find stacks of it. If you go into the doctor's surgery, GP surgery, masses of stuff. So keeping the literature aside, what can be done to support older people? Well, only really the things that we've talked about already is somehow or other somebody taking responsibility and saying, I'm going to make that contact. because we know very well people can't even read in some cases. I mean, we know that the levels of literacy in our country are remarkably poor in some ways. People don't read. They won't read because television and computer screens have effectively taken that away, haven't they? So I think that it's about encouraging positive engagement of the type that, well, get another national newspaper to run another campaign like the Daily Mail has done for the work in hospitals, is to do that in the community, so that it's about the social care side of the business as well.
Now, this is an interesting question, and I'm looking forward to hearing your insight on this.
You are.
Especially because you said you don't have did you say you don't have a smartphone?
I have no smartphone, and I have a keyboard computer.
So this is a good question to ask then. So digital technology has, as you know, has the potential to transform the way patients engage with services, and it can improve efficiency and coordination of care. So the NHS is already embracing digital in communicating about its services and initiatives. So keeping that in mind, what are the potential benefits and challenges of this for older people?
There is a particular problem because within the body of people that you would call older, post-65, that's a generation that there are generations, because we've got people going on, as we said earlier, up to 80s and into 90s, haven't we, who were not brought up with the technology. They knew how to use a telephone. Probably many of them that started off with typewriters that didn't even have computers. So that's a handicap. And I think for those people who have never, probably they never will, if you're trying to develop something new, you need to keep them in touch with paper, or through somebody going along and telling them about it. I mean, that's another role that trained volunteers could do, isn't it? I recognise all the value. I mean, I've got a pacemaker myself, and I saw in the paper the other day a system whereby a pacemaker can talk to a computer somewhere, when I'm out on the street, and diagnosis can be done using these apps, as they call them. I think technology has an awful lot to offer. And I think that we will just see more and more, won't we? And we'll move on into another area which is not digitally unrelated, which is to do with managing data, isn't it? And I'm very interested in that, because one of the things that we've looked at in the Sounding Board is the 100,000 Genome Project. And I was amazed to find, I went to one of the early lectures about it when they first started the project. I was amazed to find when I Googled it, it's just finished.
Right. I've read quite a bit about the Genome Project and precision medicine.
At this stage, it's very specific. I think they've targeted people with cancer and people with unusual diseases. And even on the basis of the results of that experiment, they're already finding that they can produce targeted answers to people's medical problems. And that, it seems to me, is a huge area of further development, using what we call AI, which is artificial intelligence, isn't it? There's an even more dangerous thing, which I was just reading about as well, is with our understanding of genes now. This is a Chinese scientist, I think, who's been very naughty and broken the rules, and he'd been doing this. Are you familiar with CRISP?
No.
CRISPR. I've got an article here you can read in a minute. But CRISPR is about taking pieces of genes, cutting them out chemically, and in this case, this scientist had gone beyond the rules and taken some bits out to do with HIV, try and avoid the child having, and the adult in due course, having HIV. He'd done it on an embryo in the laboratory and then let the embryo develop. Well, the normal procedures with these scientific experiments, you can do it on an embryo, but you certainly don't let it loose. And he's going to get berated for that. If it's true, there is a certain amount of suggestion that perhaps, as happened in the early days when they're trying to get the human genome done, well, we've done it. Have you? No, you haven't. But eventually, of course, it was done. But the speed with which those things can now be done is quite amazing. And the point about that brings us back to this thing about patient at the centre, doesn't it? Because in an ideal world, at least, with enough money and enough expert people to work at it, it becomes totally personalised medicine.
Yeah.
And can anybody argue against that?
And there's GP Online as well, which is, are you familiar with GP Online?
Well, there are these online services like, 911 and so on. 111. That's an American 911, isn't it?
Yeah.
111 and so on. This is doing a little bit of diagnosis over the phone, you mean?
No, so the GP Online is basically you don't have to go to your GP to get repeat prescriptions.
Oh.
So if you sign up with your GP, then you can just do and reorder your medicine online.
I do that myself. Okay. Yeah. And I'm interested because it seemed to me a bit of an oddity, really, that in fact, I think I've got a statistical sheet somewhere which says that something like 80% of people are very happy with using online for that particular purpose.
Yeah.
And so that's a very encouraging figure, isn't it? What is much more difficult, I think, is people getting information in a digital form, which is other than that straightforward, what is a straightforward process, isn't it, of getting a prescription, but of trying to inform people about stuff. And trying to encourage your clients, for the GPs particularly, and the hospitals as well, isn't it, to keep appointments. Big waste. As a big waste. Unfortunately, we live with human beings, don't we? But when people moan to me about the health service, I just say, well, I know quite a bit about it, various angles. You hear the bad stories, but think of how many good... if I find somebody in the care home who's been in the hospital, I ask them about the experience, and invariably they'll say they've had a good experience.
So now that you've spoken so much about your experience and, your work that you've done on the Sounding Board, can you give some of our listeners tips on how older people can get involved in improving services locally?
I think campaigns like that to encourage people and lots of little personal stories, because the point about a lot of volunteering is certainly helpful, isn't it, to the system. But it's good for the people, who are doing it. A lot of stories in the Daily Mail the last couple of days about how good people feel because they've been involved. And it's just a matter of raising that threshold a little bit more so we can get a few more people involved, isn't it? I mean, all the tips about not falling and all that sort of stuff. I mean, there's paper around all over the place. There's programs on which you could pick up on YouTube or Google or whatever for people about their conditions. I think we've probably covered it in one way or another. Local groups, churches and places like that, film societies, putting on films and charging a £5. That may be too much, I guess, but I know how difficult some people's budget is. But and I do think the government does need to provide a little bit more in the way of social support, because even if the support systems are there, people sometimes haven't got the money to go and get to them, have they?
Well, thank you so much for giving me your time and coming to Quarry House and talking to us. It's been very useful, and absolutely appreciate your passion and energy to be part of the NHS and do some good work. So thank you.
You're welcome.
You were listening to an NHS England podcast brought to you by NHS Citizen.